Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp me on 9226810630. I think everybody now knows that Professor Deshpande has started a serial, like a TV serial, but better serial, an educational serial regarding the Ayurveda in GP or Ayurveda in general medical practice. Today is the 17th of this episode, and we are discussing excessive sweating. Try to understand the basic concept about the sweat. Ayurveda has said our human body is made up of dosha, dhatu, and mala. Dosha, vata, pitta, kapha, these are the bioenergies. Then dhatu, rasa, rakta, mans, med, asti, manja, shukra. And then mala, mutra, purisha, and sveda. Sveda in Ayurveda means sweat in English. Sveda, sweat, Sweda, Sweta, very easy to understand. Okay. Now, next important, this Sweda has an intimate relation with one of the dosha, that is Pitta dosha. So, Pitta dosha and the Sweda are interconnected. So, that is called as Ashraya, Ashrayi, Sambandh in Ayurveda. I know, my dear friend. Some people will get bored. Sir, what your terminology Ayurveda? But my dear friends, if you want to learn Ayurveda, little, you must understand. So Pitta and Sveda are interconnected. Why to know this? Because simple thing. Ayurveda, whenever we take case taking, because many people say, sir, why you are charging 500 rupees? Why you are not lifting the phone? Because, my dear friends, I am busy at all the time. And that's why I have made a provision of the team of the doctors. And with the team of the doctors, we give the appointments to the patient. We take a long case taking. We ask the different questions. And then we make a conclusion. Then under the guidance of Dr. Deshpande, prescription is prepared and sent to the patient. That is why I am explaining some of the videos as a charitable and explaining in a simple but scientific information. Now, Pitta dosha is having the properties Pittam sasneha tikshnoshnam lagu vistram saram dravam. The most important property is Ushna and Tikshna. So, Pitta is hot, Pitta is a fire. So, whenever you take the Pitta Prakupita Ahar and Vihar, Ahara means food and Vihar means lifestyle. If you follow that Pitta Prakop, then naturally you will suffer from excessive sweating. Another thing, that particular sweat is also has a relation with Meda Dhatu in Ayurveda. So that is why the obese people having a lot of fat will also get the problem with the sweating. We understand? So Pitta dosha is very important, and then Meda Dhatu is also important for the sweating, these things. Okay. Then what we have to do? We have to give the pitta control. You should not be angry. You should not be jealous. You should not be too much ambitious. Okay. Eating lot of spices, chili, hot, sour, pungent food, and a lot of salty substances. Your hypertension is more, then that can cause the sweating problem. Nowadays, you can see that there are also some nervous system problems, psychosomatic illness. Brain has also relation on the effect on the body. Okay. So nervous system, Majja Dhatu is also involved in this process. And some neurological problem, the patient have a lot of sweating of the especially sympathetic system elevated or disturbed. Okay. So people say, sir, amcha hatala sardi zali hai. In Marathi, I am talking about in Marathi, Maharashtra state language, माझ्या हाताला सर्दी झाली आहे. माझ्या पाय जमिनीवर ठेवले की थप्पे उठतात. मराठीमध्ये. In Marathi language I am explaining. I will translate it Hindi and also English. The people, लोग कहते हैं कि हमारे हाथ पैर को सर्दी हो गई है, बहुत सारा पसीना निकलता है, 12 महीने हाथ पैर से पसीना निकलता है. This is one of the complaint. They say, I have all the time my hands are quite moist, watery, and also when I put my feet on the ground floor, there are the patches of the water. So this much more water is coming. Because according to Ayurveda, there is Udaka Vaha Srotas. Please try to understand. Water and electrolyte balance, this is particular system in Ayurveda. So whenever there is a problem with Udaka Vaha Srotas, then you have to remember all the causes of Udaka Vaha Srotos, Dushti and Lakshana. औक्ष्ण्यात आमात भयात पानात अतिशुष्कान्न सेवनात अंबुवाहिनी दुश्चंती तृष्णायाः च अतिपीडनात. Oh my God, sir, you are telling us the simple excessive sweating and what Sanskrit, sir, you are boring. No, it is not bored. If you are really interested in Ayurveda and learning medical knowledge, you should keep patience. Otherwise, you go for reels. Only reels. Reels, comics, it's for some time. But for some time, you must be serious in your mind. Udaka vaha srotasa. Udaka is a water. So this is a distribution of water. Aukshnyat, amat, bhayat, panat. Aukshne, excessive heat. Ama, toxins, inside and outside toxins. Indigestion is also creating ama. Ama means toxin-like substance. That is ama. Aukshnyat, amat, bhayat. Mental stress. Panat, lot of alcohol. That can cause a problem with udaka, vah, srotasa and gives the excessive sweating. I have described little Ayurveda. Now we will start the modern causes, investigations, and Ayurvedic medicines, Ayurvedic prescriptions. Let us start. Etiology. In the hospital, most of the serious medical and surgical emergencies are associated with excessive sweating. So if in the ICU patient, serious patient having a lot of sweating, be serious, be careful. I'm explaining two important diseases which gives a lot of sweating. In the GP, the condition may be seen in two forms. One is generalized whole body excessive sweating, or as I have told you, localized excessive sweating on the only hands and palm and feet. Do you understand? Localized. Causes of generalized full body excessive sweating. Simple thing, fever. Whenever you get the fever and whenever you take the Crocina tablet or Ayurveda Mahasudarshana Kadha, then you get antipyretic, reducing the fever. Lot of sweat will come because all the antipyretic drugs are diphoretic. Please write down diphoretic, which increase the sweat. Why sweat is increased? Because with the help of sweat, internal body heat is removed and your fever comes down. Are you getting my point? Okay. Then this is the most important, you should not forget. Myocardial infarction. Myocardial infarction is heart attack. Very serious, patient can die. Mild heart attack, it's okay, patient can save. Moderate heart attack, okay. Severe heart attack, big coronary branch is occluded with the coronary thrombosis, end of the day. So myocardial infarction, the patient will have retrosternal chest pain. This middle, this is the sternum bone, retrosternal. If the patient says, doctor, I am having the here left side in the heart region, there is a pain and little bit this, that is not, this may not be the heart attack. But if the patient is restless and cannot speak properly, having the nausea and clenches his fist, doctor, I am squeezing pain. Oh, severe pain, doctor. I cannot. That's seriousness. And at the same time, here, you can get the pain in the jaw. You can get left hand pain in the back. Referred pain of heart attack. That also you have to, you must do the ECG. And at least for 24 hours, you admit the patient. But what I am talking right now, how you can identify the heart attack, that in addition to the retrosternal chest pain, there will be profuse sweating. Too much sweating to the patient. Here, his clothes are wet. So you must suspect, oh, OMG, oh my God, this can be heart attack. Please note this particular symptom. In addition to the pain, in addition to the discomfort, profuse sweating will give you the idea about heart attack. Yes. Then peptic ulcer. This is not that much important, but yes, peptic ulcer. Yes, second one. This is number 2 important cause. First is a heart attack and second is hypoglycemia in a diabetic patient who is especially on the insulin. Senior citizens up plus 60 plus 70 plus, what they do, many times they feel, today I don't have gas in the stomach, I have the little bit loose motion, I have the little bit constipation, I don't want to eat. But family members, they insist the patient to take the tablets, to take the insulin, because then they feel that if he is not taking insulin tablets, problem. But you don't understand, my dear friends, that senior citizen has not taken any food. So, without taking any food, if he is taking the tablet or taking the insulin here, subcutaneous, then he may get at night, especially hypoglycemia. Oh, dangerous. How to identify? Drowsy patient, he cannot follow your command. Baba, काय होतंय? काय झालं? Only verbal or non-verbal, it will be drowsy, not responding to your command, and most important, profuse sweating. Profuse sweating for the whole body, here. The weight is wet, water. Sweating will be there. So heart attack and hypoglycemic coma, both the conditions can make patient die, fatal. So my dear friends, never forget after this lecture that Dr. Deshpande was crying and screaming and telling that heart attack and hypoglycemia can be diagnosed by profuse sweating. No other YouTuber is making such type of action because they don't have any such type of the, what you can say, the feeling to that in front of the viewer should understand what I am saying. So this is, by my father is fortunately, by God's grace, he is 91 and my mother is 87. He had got this type of problems many times. Hypoglycemia. If he is by chance little bit conscious, you immediately put a glucose. How I have diagnosed? Not only with the profuse spread, you should have the glucometer. Glucometer, you know that. And you can immediately give the prick, put the strip, and you will find by machine that it is showing that 70, it is showing 60 number, 50, oh my God, it's hypoglycemia. Normal should be 80 to 120 milligram. So I have given enough time to explain you these two problems. Heart attack and hypoglycemia can be fatal. FATL means patient can die if you don't diagnose proper. Immediate hospitalization is essential. Acute abdomen, this is another third important point. Many people say that I am doctor having pain and that my father, that mother, she is having so much tremendous pain. There are two types of pain, normal pain and surgical pain in abdomen. Surgical pain in abdomen is called as acute abdomen. Surgical pain in abdomen is called acute abdomen. Very serious, because the patient has to hospitalize, make a surgery, and then only patient can be saved. What are the surgical conditions? There may be ulcer, there may be perforation. The intestines, they go inside to each other, into susception, intestine coils go inside to each other, or squeezing, that is called as a volvulus of the intestine. So perforation, into susception, volvulus, these are the three conditions which can make serious pain in abdomen. Patient should be admitted in the hospital. And that also having with the sweating, lot of sweating. There is absolute constipation and your abdomen is like a board, hard board like feeling will be there, and severe tenderness will be there. Are you getting all these things very interestingly? Okay. Severe pain like acute renal colic because of the stone, drug reactions, sweating. We are talking about sweating. Don't forget it. Due to the obesity, this is okay. Then hyperthyroidism. This is very interesting. Hyper and hypo. Thyroid gland here. Hyperthyroidism, T3 and T4 blood tests are high, TSH is low. Hyperthyroidism means excessive metabolic processes. Heat is generated. Okay. So there may be sweating. Causes of localized sweating: fear, tensions, anxiety, severe pain anywhere in the body. Now treatment: rule out the cause and treat accordingly. If no specific cause is found, go for symptomatic treatment. Lakshanika chikitsa in Ayurveda, Pitta Shamaka Upachar, Vata Shamaka Upachar, nutritive treatment. Chandanadi Vati, sandalwood, 2 tablets, 3 times in a day. Praval Bhasma or Praval Pishtivati, Hari Parashurama Aushadhalaya, or anybody you can take. Hari Parashurama Aushadhalaya is an Ayurvedic pharmacy from Khadiwale Vaidya, Pune city, Maharashtra state, India. 3 times in a day. Kanakasav, 3 tablespoons with equal amount of water 3 times in a day. This is one prescription. Now, second prescription. San Shamani Vati from Guduchi or Giloya. This is best Pitta Shamaka. 4 tablets 3 times in a day. Then Vanga Bhasma. Vanga is a metal, purified metal, is Kledanashana. Whenever there are excessive water problem, always we use the Vanga Bhasma. 1 tablet 3 times in a day. Then Chandra Kalaras is cooling, 2 tablets 3 times in a day. Gokshuradi Gugulu, Gokshur is a diuretic. So automatically when urine is more, body sweat becomes the less. That is a what you can say, the electrolyte and water balance. Okay. Then Rasayana Churna, that is contains the Avala, Gokshur, Guduchi and Amalaki. Sorry, Avala, Guduchi, Gokshur and Ashwagandha. This is called as a Rasayana Churna, as a tonic. 1 teaspoon 3 times in a day. No, for local application, use the dry powder of Vacha. That can also control the excessive sweating. I think, my dear friends, this is the end of this interesting topic of excessive sweating. For getting such a interesting videos, I again, by folding my hands, request to press the bell button icon and subscribe my YouTube channel and support my what I can say, the energy and enthusiasm. Because of the love and because of the blessings of yours, I am giving or pushing my channel ahead and ahead. Thank you very much. Take care. All the best to you.